Pain management during labor and birth. Pain is individual and subjective. In other words, it's what the patient says it is. People will perceive and respond to pain differently. The LPN will assist the RN to help manage the pain that's associated with labor and birth. There is a uniqueness to labor and birth pain. Instead of being associated with a disease process or an injury, it's associated with a normal physiologic response. It will increase in intensity as the desired outcome, which is birth, approaches, and it's predictable pain. During the first stage of labor, that physiology and characteristic of pain comes from the thinning and the stretching of the cervix in response to those uterine contractions, and we see abdominal pain. During the second stage of labor, it's from the stretching of the tissues in the perineum as the fetus descends and burning sensations in the perineum. Different factors that affect that labor pain is the client's threshold and tolerance for pain, their age, and how many labors have they been through, their parity, their anxiety level, their culture, their physical condition, the length of the labor, the size and the position of the fetus. Is it induced versus natural? Is the labor dysfunctional? For example, back labor is usually associated with a brow presentation as the occiput puts additional pressure on the sacrum, and it can be very painful. So question, the pain of labor and birth is unique to the woman giving birth. It's a multidimensional experience consisting of many factors. What is one of those factors? It is the woman's culture. So there's no one perfect way to control labor pain. The woman needs to explore different methods of pain relief and then utilize what works for her. And it may involve more than one. In fact, several might be used at the same time. Pain management during labor needs to be planned and implemented. Practice of techniques prior to labor will make those techniques more effective during labor. Principles include intervention, safety, and involvement of the woman in her pain relief. We have non-pharmacological interventions and pharmacological interventions. Non-pharmacological interventions can include that continuous labor support from the nurse or a doula who is a trained layperson, and that decreases the need for pain medications or interventions and C-sections. Comfort measures, relaxation techniques, which include patterned breathing, attention focusing, such as imagery and meditation, movement and positioning, touch and massage, hydrotherapy, hypnosis. Intradermal water injections, which involves the injection of sterile water at 4 points just above the sacrum, and it can provide significant pain relief. Acupressure and acupuncture. Heat, cold, position changes, walking, rocking, the exercise ball, aromatherapy, and music are all helpful. With pharmacological, we're looking at analgesia and sedation. Analgesia is going to reduce the sensation of pain, where sedation is a state of induced, or where we reduce anxiety or stress and promote sedation and relaxation. For example, barbiturates are going to promote sleep, and opioids will increase the woman's ability to cope with labor. However, it can adversely affect her or her infant, can cross the placenta, and it's also important to monitor the newborn during the neonatal transition period. Anesthesia is going to partially or totally block all sensation to an area of a body. With regional anesthesia, we have the pudendal block, epidural anesthesia, an intrathecal injection. Complications, the most important one is hypotension. We can also see total spinal blockage, respiratory and/or cardiac depression up to arrest, a spinal headache, pruritus, and urinary retention. And then we have that spinal block. General anesthesia, it's not frequently used due to the risks involved, especially to the fetus. It will cause significant respiratory depression in the newborn after the administration of general anesthesia. Epidural is what is used most often, but there's also a risk of malignant hyperthermia with this. This is a table that I've prepared that shows some different drugs that might be used, when it would be used, what its advantages and disadvantages are, and by no means is complete. There's definitely other drugs out there. Doing an epidural, this kind of shows you the area in which an epidural is administered and the position we put mom in to administer an epidural. So, true or false? Malignant hyperthermia is a potential complication of general anesthesia that has genetic origins. This is true.